Healthcare Innovations Ambulance Service is rebranding as North County EMS. Why should you care? Because the next time you need an ambulance, it might be good to know who you're dealing with. Let's go. And welcome back. I am your host for this episode of the Southwest of Center podcast. And we have a very special guest today. All my guests are special. Anthony Kugler. And Anthony, thanks so much for being with us. We are talking about North County EMS, as it's going to be known or is known, from HCI. And before that, it was Benson Ambulance Service.
That's correct.
So give me your two titles. You're head of EMS, and what's your other job or hat?
For the corporation, general manager. And then within the operations side, it's chief of EMS. So kind of wear two hats there.
When are we going to start seeing the North County EMS logo?
So everything was approved with the Arizona Corporations Commission. We filed everything because again we're an organization and a corporation. So we did all that. That was effective January 2nd because the first being a holiday, of course. Mm-hmm. And then we have to notify the Arizona Department of Health Services, Bureau of EMS and Trauma, who we're regulated by. Once that went through, we notified them. They have 30 days in which to reissue our certificate of necessity, which is the document.
Yeah, explain. First of all, let's remember to keep one thing in mind as we discuss this. Why should people care? Mm-hmm. And what is your certificate of necessity, and how big an area do you serve? So, first question: why should people care?
Well, about two things, right? Part of the rebranding as we move forward is we want to represent the community.
HCI, Healthcare Innovations to North County EMS. We want folks to understand and realize that we're their service. We're not just a corporate service. There's many different ambulance providers within the state, private and public. But however, we belong to the people here in the north half of Cochise County because that's the area we serve. When you say the north half, give us just some of the communities.
Absolutely. So starting in the west end, the Pima County portion of Mescal, J6, then the Cochise portion of Mescal, J6, the city of Benson, the city of St. David, or I should say towns, of St. David and Tombstone, as well as the city of Wilcox, towns of Bowie and San Simon. Our area it starts at Marsh Station on I-10, if you consider that the west boundary, and it runs all the way north to the Pinal County line.
Oh, my goodness, really?
And then follows that line all the way across the top of Cochise County to the New Mexico state line. So we have a little over 100 miles of I-10 that we cover.
Oh, lovely.
Yeah. Yeah, it's a very big...
Gets you into a lot of messes.
It is. And then if you kind of go south, we go all the way down Highway 90 to the Border Patrol checkpoint. Yeah. So just outside Whetstone there. Yeah. And then we go all the way down to Tombstone and about halfway to Bisbee. Between Tombstone there is our cutoff. And we come back up around the Pierce Sunsites area and then all the way, like I said, to the New Mexico state line.
Anybody who's lived here for a period of time, I think, can visualize that.
Yeah.
How many square miles is that?
It's 3,414, and maybe a few extra feet in there.
And you have 3,400 square miles, and how many people to service it?
Just under 50 currently.
Okay. It's a fairly large ambulance service, but it's probably got one of the largest service territories in the state.
We do. There are some certificate of necessity.
Explain what that is.
So back, I believe it was around probably mid-90s, the state of Arizona, previously, anybody could start an ambulance service in anywhere you wanted. And, of course, the more populated areas would gather the ambulance services, and the rural communities went underserved or not served. So the state of Arizona got with all the stakeholders, fire departments and ambulance, private or public, and said, how do we make this so we ensure coverage through our entire state? So they granted these certificate of necessities that were based on a geographical boundary that ensured this is your area of responsibility. So along with some of the metropolitan or more dense populations also comes some of the less dense populations to force those providers to have some...
The ones that only wanted to serve the very dense populations.
Correct. Yeah. And it forced them to invest in those other populations that nobody had in the past.
So is your certificate of necessity unique in the area that it serves?
Well, it is in the sense that we are the documented provider for that area. Just as if you go, to the city of Sierra Vista, they have a certificate of necessity.
And I was going to point out that's why you don't extend further south. They have their own.
Correct. We border Fry Fire's certificate of necessity on Highway 90. And then...
well, I was going to say, what about to the southeast, like Douglas?
Douglas has a certificate of necessity as well. Bisbee Fire has their own. Just
now, don't you all have mutual aid agreements?
We do. We do have mutual aid agreements.
Explain to people what that is.
So mutual aid is at any time when either the incident reaches a point where you don't have enough ambulances to service the number of patients that you have.
Yeah.
You can request mutual aid, and that happens quite a bit on I-10. You get a couple trucks that lay on their side, a couple cars that may crash into them, and you've got
a mess.
You do have a mess, and a lot of times they'll refer to it as a mass casualty incident, but it requires help from our partners. So we have a mutual aid or a backup agreement with AMR out of Safford. That at any time we need help from them, they'll come down and help us out there.
Well, that's good to the east. What about the west?
And in the west, we have mutual aid agreement with Rincon Valley Fire off of I-10 there.
Didn't that happen recently up near Marsh Station Road?
Yes, it sure did.
You had a semi and a car or several. To explain that.
That's correct. And especially right now, it's very difficult with the construction.
Oh yeah,
on
and
I-10.
I have people are so mad about that.
Yeah. Well, I think the reason people were upset, and we were upset just as well. ADOT, I believe, and this is my opinion, did a very poor job of reaching out to the folks in Cochise County when we did when ADOT did the construction on the bridge over the San Pedro. We had meetings months in advance. There was communication and email. Now with this construction at Emporita, we heard crickets until I saw the variable messaging sign going up saying, hey, this, we're going to lose this left lane on a certain day. We had no notification whatsoever. And in talking with some of the other fire chiefs around, I don't believe they had it as well.
Well,
so that was very confusing.
The public was taken totally by surprise.
Absolutely.
All right. So enough about that. They did a piss poor job. Sorry, but it's a podcast. I can say what I want, of telling people what to anticipate. But beyond that, what kind of problems has it caused for you? And talk about that incident.
Yeah, back to that incident. There's been another where an incident has happened west of the Emporita Bridge. And, of course, once that happens, you start to get traffic that slows down or backs up. Well, now you've backed it up into a single-lane bridge under construction with no emergency shoulder.
Mm-hmm.
And so the most recent incident, because it is in our area, our certificate of necessity, our ambulance got to within about 2 miles of the incident and couldn't advance any further. And one of our paramedics took her bag and actually walked that 2 miles to get to the patient. Now, of course, we reached out mutual aid with Rincon Valley Fire, and they were able to come down, get off at Marsh Station, come across and go against the flow of traffic. We call it wrong way, and access that patient. So our folks were able to kind of stabilize. We didn't have an ambulance to put them in because we couldn't get it close enough. But once, the firefighters, paramedics from Rincon Valley Fire arrived on scene, we were able to transfer care to those folks.
So that's a good example of mutual aid and how that mutual aid agreement works. Let's get back to HCI and North County EMS and your rebranding. Again, why is this so important? Because you said it reflects the mission of serving the northern part of Cochise County.
Like I mentioned, kind of twofold, right? We want to represent the communities in which we serve. And we looked at all various names, like Northern Cochise, and we said, can't do that. They might think you're part of the hospital.
Yeah.
San Pedro Valley, can't do that because we also service Sulphur Springs Valley and San Simon Valley. And the one thing that was consistent is we service the pretty much the entire north half of Cochise County. So North County kind of made sense. One of the other reasons it was driving the name change is Healthcare Innovations is a company that also exists somewhere on the East Coast or Midwest. And at times we would receive payments online for these folks because people go online to pay their bill and they don't realize and vice versa, right? And so it created some confusion.
Well,
so we felt like it was a good opportunity to make that change.
Healthcare Innovations to me sounds like a hospital pitch line.
Sure, sounds like we manufacture equipment for a hospital.
Exactly, right. Yeah.
Well, going back to the how Healthcare Innovations came about. So prior to Healthcare Innovations, we were Benson Ambulance Service, which is
way back,
1991, right? And
I think my sister may have worked for Benson.
She may have. I'll have to go look. And at that time, what it was is the ambulance service was provided by the county. Cochise County provided the ambulance service, and it got to a point where they couldn't provide it anymore. They would have days where they had no providers or didn't have a truck. And so the Arizona Department of Health Services reached out to our founder and CEO, Jim Broom. And Jim had a standby ambulance service because he was into drag racing. And so he had a kind of a rescue ambulance out at Tucson Dragway. And so they knew he had this little service. And they asked him, hey, you ever thought about maybe providing service for Benson? And they did. So Benson Ambulance Service was born. And it covered Benson and St. David, I believe, at the time. And then over a period of years, I believe Tombstone was to come on next. Their ambulance service had fallen off, because it was difficult finding providers. Most of these folks worked a regular job and then were volunteers at a fire department or something, and they would jump on an ambulance. And then
that's of course, not the case now.
No, not at all. We're 100% professionally staffed.
Yeah.
So then Wilcox followed suit. Bowie had an ambulance service that was Bowie Fire for a little bit, and they got the same problem. Either had one provider or they could only transport to the nearest hospital, and that wasn't always where that patient needed to go because we want to get patients to the closest, most appropriate facility, right? So just, DHS kept reaching out and said, hey, you're already covering this area. Would you mind covering this area? So that's how we ended up with the 3,414 and a few extra feet,
So tell me what it looks like. I have, I'm at the grocery store and a guy collapses and, people are giving first aid. Looks like he had a heart attack. Dial 911. What happens?
So currently what happens is you dial 911. If it's in the city of Benson, it's going to go to the Benson Police Department. They're the PSAP or the Public Safety Answering Point for the city of Benson. And they will first start by inputting that call into their dispatch system. And they're going to dispatch the city of Benson Fire Department as well. And that system is also tied into the Regional Communication Center, which is called CCOM, Southeast Arizona Communications, which is in Sierra Vista. And they dispatch pretty much for every agency in the county with the exception of Douglas and the agencies here in Benson.
Well, what point have you pulled into the loop?
So once it hits CCOM, that's our dispatch center. Then they will go ahead and they will assign. The system tells them based on where it's at, what ambulance they need to dispatch, and they will go ahead and dispatch that, and we'll respond. There is some delay depending on where it's coming from. So sometimes if it hits Benson first, there might be a minute or two delay by the time it gets to CCOM and we get dispatched. And then vice versa. Anybody that's coming through with a cell phone on I-10 or maybe up on 90, that call may route to CCOM, and then Benson Fire gets the delay or Mescal Fire gets the delay. So having those two PSAPs does create a slight delay.
What is the average response? Let's say you've got to respond to I-10 north of Wilcox. Where is that crew going to be dispatched from?
So they're coming out of our station 153, which is in Wilcox, pretty much midtown, right off of Maley and Haskell. Mm-hmm. So, we have about it's about a 20-minute response into Bowie, and then up to 35 to 40 to San Simon.
Okay. Same thing happens in this area. Where's the dispatch?
Our station in Benson is station 151, which is right next to the hospital on Ocotillo. If you ever drive down Ocotillo and you look at the hospital, you see all those ambulances parked out there. That's where our station. Yes, sir. And we have two ambulances that are staffed daily out of this station.
And when you say staffed, how many people per ambulance?
Two per ambulance, unless we have a somebody in training, then there'll be a third on that ambulance.
Is that standard? Is that a national standard?
Well, you need two. Somebody's got to drive it. Somebody's got to treat the patient, right? So,
is there a standard that says we got to staff 3?
You mean number of
4? Yeah,
number of ambulances or
cases.
number of personnel?
Personnel.
No, yes, the requirement is 2. You have to have 2, and they've got to be certificated by the state, either as a in certain instances you can use an EMR, which is an emergency medical responder. That's basically somebody who just has first aid and CPR, right? And that's for it's going back and forth in the legislation right now, but that's for populations under a certain demographic or a certain amount. They allow you to do that because some of the rural communities have trouble finding paramedics and EMTs. So it's much easier for them to do this few hour course and get an EMR, and they're allowed to. That basically makes them a driver, right?
Give us an idea of the level of training and certification that your people have on average. I realize not everyone's going to be the same, but
right,
yeah,
yeah. So we are actually extremely lucky. In the past year, we've been able to upstaff our personnel and increase their training. Prior to about a year and a half ago, we staffed 3 paramedic ambulances and 2 EMT ambulances.
What's the difference?
The difference is level of skill and the scope of practice, right? And the what kind of medications or drugs they can administer. The EMTs are basic life support. Means they're trained in trauma, stop bleeding control, cardiac arrest, things like that, right? Mm-hmm. They're just to keep you alive and get you to a hospital.
That golden hour.
That golden hour. Paramedics, on the other hand, with their advanced training, their drug box, and the tools they have available to them, can do a lot more interventions in the field prior to that transport.
So, Anthony, you've got a situation where you've got a pile up on I-10 and you've got to dispatch people. How do you know that you need paramedics as opposed to EMTs or the other way around?
Sure.
Or do you just throw it out there?
No, not at all. Not at all. It's as I was mentioning now, every single one of our trucks is ALS, right? Advanced life support, either with a paramedic or an advanced EMT. And advanced EMTs now have a bigger drug box, right? They can do pain meds. They can do a lot more things that basic EMTs could not. And some of our trucks have dual ALS providers on them.
Really?
Right? So that's our goal. So we have our own training center, which is unusual for such a small organization. It's in Wilcox, at our station in Wilcox, which used to be the old hospital in Wilcox.
Oh, really?
Yeah, it was bought and then we remodeled it, and so it's half of it's a station, half of it's a training center. Our training director, or our training chief, is not only a paramedic, but she's also an emergency room PA. So
physician's assistant, yeah.
And she currently works in ER. So as well as she has a background in education, so she's great for that role. So with our current medical direction, which is International Medical Directors out of Phoenix, very progressive medical direction team, they have allowed us and made it possible that we can now start training our own folks and bringing them up. So we hosted the second advanced EMT class in the state of Arizona, second by only a couple days. It was all through IMD, but Arizona Western College out of Yuma beat us by a couple days just for the scheduling. And we're getting ready to host another one. And again, we're trying to advance the skills of our folks. We have, through our medical director, they're working on the critical care ground paramedic course, which is another step up from paramedic, similar to like the flight crews that you see, and whether it be Lifeline, Arizona Lifeline helicopter or PHI, those guys are critical care or flight paramedics and a nurse. So we're working to advance our skills because we want to make sure we're serving the community.
So I'm in an accident north of Wilcox, or I'm in an accident west of Benson. Mm-hmm. Am I going to get the same level of emergency care at either incident?
Yeah, absolutely.
That's
absolutely.
Some people might say, well, it's better to crash near Wilcox because the level of staffing or whatever.
Well, if you go back, if you go back, like I had mentioned, about a year and a half ago, where we had ALS and BLS, right? The goal was to use the basic life support for the lower acuity calls, the fall, the lift assist, things like that, to keep those advanced life support units in service. It always never worked. Because a stroke would come out and the ALS truck would get a stroke. And then next thing you know, a cardiac arrest would come out and the BLS truck was the next closest. Now we would also dispatch another ALS unit in that to go en route and try to intercept or help if they need be. Sometimes they did, sometimes they didn't need it. But now with all trucks being advanced life support, you're getting closer to that same service.
Now, I know that it's going to be different depending on the holiday, the time of day, what incidents are happening. But excuse me, but what is an average day like, if you can say there's an average day?
I'd love to say there's an average day, and there's not. Just for example, we also, besides responding to 911 calls for service, we are also responsible for the transfer of patients out of both Benson and Northern Cochise Hospital, because these are critical access hospitals.
Let me explain what that looks like. Someone goes to the ER with chest pain.
Correct.
Then they have to be transported to a different facility for whatever reason that you guys do that.
Correct. Yeah. The ideal goal is to get them to definitive care, right? Yeah. And Benson and Northern Cochise are great facilities. However, they're not always definitive care. You have a patient that's got, a cardiac issue. You want to get them to a cardiac receiving center, right? We've got to get them to Tucson. So we do those as well. Now those,
now, Anthony, I want to say, you're not just going to take that person, throw them in an ambulance and go. The ER there at Benson, which is excellent, I have to say, is going to stabilize the patient. Correct. They're going to do everything they can to make sure the patient's ready for transport. So it's not just throw them in, let's go.
No, I wish it was that simple, right?
Right.
No. There's in a lot of these patients we're transferring out, what we call an interfacility transfer. Or majority of the patients we bring in, we get to see them again, right? So we get them to Benson, we get them to Wilcox, because again, we want to get them stabilized, get them evaluated. Now there's sometimes we'll go straight to Tucson. If we realize it's something that hospital can't take and that patient is stable enough for us to make the trip under the paramedic or EMT's care, we'll go straight to definitive care. We'll go to TMC, Rincon, one of the closer ones. And it's all about what's their level of service. We have 2 trauma centers level 1 trauma centers, I should say, in Tucson. That's Banner, Maine, off of Campbell, the university there. And the other one is St. Joe's off of Wilma. So, but you're right. Most patients get transported locally to Benson or Wilcox, Northern Cochise, I should say. They'll be stabilized. The doc will evaluate them. He'll come up with a diagnosis, and then they'll reach out to an appropriate facility to take that patient. And then, of course, it's a bed search. Sometimes it can take several hours. Sometimes these patients are overnight or spend a day in the ER, depending on what type of medical situation they have and where the best place is to get them. Then the hospital will contact us and say, hey, we've got a bed available at X hospital. When can you come get this patient? Now, if it's a time-sensitive patient, which are strokes, STEMIs, cardiac issues, or traumas, we have to respond to those immediately. Just like if it was a 911, it means that if it's the last ambulance we have in the county, it has to get that patient out of there because this is time, right?
Now, Anthony, there's a big difference between someone who may be suffering a heart attack and someone who's just been shot 3 times.
Correct.
Your ambulance picks up that person that's just been shot 3 times. What does that look like? What happens?
So, depending on where it's at, too, we might also call in for an aircraft, right? An air ambulance. They have, having a flight nurse and a flight paramedic on board, they have some tools as well as some medications that we don't carry on ambulances that may help depending on what's going on with this patient. So if we have somebody that was shot 3 times, where were they shot 3 times? Can we manage, they shot in the leg, can we manage the bleeding with a tourniquet, and mitigate that? The quickest thing to do is get a helicopter and get them straight to a trauma center and get them into surgery.
There might be times, though, when you don't have a choice.
There's a lot of times we don't have a choice and we have to go to the nearest facility, whether it be Northern Cochise or Benson. And then we'll start there. With the understanding that it's a pretty good opportunity or a pretty good chance that we're going to take these folks out later, or they're going to fly them out later because they'll put them on helicopters as well and transfer them that way.
Now, how is it still? Let me make sure I get this right. It's still HCI as we speak.
Correct. So it's it's Healthcare Innovations doing business as North County EMS.
North County EMS.
Correct.
How are you funded?
So we are fee for service. We are a private company. We are not publicly funded. Back when we were Benson Ambulance Service, we were a not-for-profit, and we were funded by the San Pedro Valley Hospital District.
So that means you bill the insurance, the patient.
Correct. It's
but
like
that's
I said,
not
it's fee-for-service. We don't receive any government funding or tax money.
Yeah, but again, you're picking up that guy that's just been shot 3 times. You're not going to waste time asking him.
Not at all.
Okay, so how does that play out? I mean, and how often are
patient
people
care comes first?
Okay,
right. Patient care comes first, and then we get to the if it's one of those things where we're not able to obtain that info. So on your normal sick person, where you've got a few minutes to gather that, you might ask them, "Hey, who's your insurance provider?" And most of them will know. They'll say, "I'm Medicare, I'm Blue Cross, I'm Aetna," and we'll get that, and we'll ask them for their social. Socials are extremely important. I always thought people would be a little apprehensive about providing their social, but when you explain to them, these are how your medical records are tracked. So we need to give this.
Yeah, I'm glad you brought that up. A lot of people don't realize that.
Yeah.
A doctor, especially in an emergency situation at TMC, if they have the social, they can go on and the information is networked between hospitals and medical facilities.
Yeah.
They can look up, they may need to know, is this person on an anticoagulant?
Correct.
And that person can't tell them. So they can look that up. Yep. Boom.
Yeah. I mean, documentation is king. I went to a chiropractor about a year ago because I kind of twisted my back a little bit. And the first thing he did was he hopped on his computer and he knew everything about me at that point.
Yeah.
So that's extremely important. And we have all that data as well, at least on our end. We record all that. So if we have a patient that we've repeatedly or had transported in the past, as soon as our folks are putting that information in, their history's coming up. So, and we'll start validating, are you still on this medication? Are you still, is this still current?
So pay for service, you're a business, you have to clear profit.
Correct. Yeah,
no way around it.
No, absolutely. And
if you don't, which is not a bad thing because you have a service to keep going.
No. So actually, because we're regulated by the Department of Health Services, and this goes for everybody, we're regulated and we can only generate a 7% profit, which isn't much when you think about it, right? And the reason for that is to ensure that the state gets the lowest, most reasonable rates, what we call a base rate for an ambulance.
What is it?
Ours is a little over $2,000.
Now, does that compare with other certificate of necessity services, or where do you fall on the spectrum?
Yeah. So there's going to be.
I would imagine that
they're all different, especially when you look at somebody like a fire district or a fire department that's publicly funded. They're able to lower their base rate a little bit because they're being, much of their operation is funded with tax money.
Well, I would think in a city like Phoenix, you would have a higher base rate because of the density of the population. I don't know. Does it go the other way?
Yeah, it's quite the inverse. So theirs is a little bit lower, and you got to look at City of Phoenix too. They're transporting only a few miles, right?
Yeah, well, that's true.
Where we're
rural area, you could pick up someone and have to go 120 miles. Yeah,
sure. Yeah,
right.
I mean, and as far as in the facilities, we transported to Texas, New Mexico,
really,
Nevada, Phoenix.
So what's the most frustrating thing about what you do right now? Is it funding? Is it staffing? Is it the service territory? It's got to be a biggest challenge.
I think territory is definitely a challenge because we have so much space in between the towns that we service that it creates a lot of dead time when we transport. So
I don't know. Do you really want to?
Yeah, I'm sorry. Yeah, that's probably really poor choice of words, Jeff.
So, Anthony, we have dead time in broadcasting and podcasting. You don't want to have dead time on ambulance.
So what I should say is that there's a lot of time, a lot of windshield time.
Don't worry about it. Yeah. Everyone does something like this, depending on what the topic is. But anyway, go ahead. So windshield time.
Yeah, we get a lot of windshield time, right? Which is either time that ambulance is away from its station. So you're pulling resources out of its area. Yes, because if we have an area where we're having trouble to respond to in a timely manner, it's not easy just to throw up another station because there's nothing out there. There's no infrastructure. There's nothing, right? So we have to get to the next closest community. So our stations are Station 151 in Benson, Station 152 in St. David, which is also where the Arizona Lifeline helicopter is housed.
Oh, is that where? Okay, I wondered
That's our
about
station
that.
there. They lease that base from us. Station 154, which is in Tombstone, and then Station 153, which is in Wilcox.
So 4 stations.
Currently.
How's that working out?
We could use one more here in Benson. We've been in negotiation with Eldorado Holdings for some land above Highway 90.
Yes.
Where we were trying to do a partnership because the fire department desperately needs a station up there because people are losing their insurance, their fire insurance, because they're too far away from a fire station. So our thought was, if we build us an ambulance station and we can help the fire department, we'll build a few extra bays, a couple extra rooms, and allow them to co-locate with us until they get their own built, because I believe that's in that master plan, that they're going to have a police fire complex or something.
It's in the city's master plan, City of Benson.
Is it? Okay.
Yeah, that's within the city limits. Actually, you're talking about Eldorado Holdings eventual development. Yes.
Correct. Yeah.
Yes, that is there. So is there any area that you feel is being underserved right now? And I would have to venture a guess it'd be areas like Sunsites and...
Well, Sunsites has their own provider. That's Sunsites Pierce Fire District.
Oh, okay, all right.
Yeah.
Well, and I don't want to say underserved, but just because of logistics, it's a challenge.
Absolutely. So, the most important thing to us first is response time, right? Because the longer it takes you to get there, the longer these folks go without.
Explain the golden hour.
So the golden hour has been around a long time.
It's well established medically.
Absolutely. And it was, especially when trauma centers were coming out, it was determined that somebody suffering a trauma had the best chance of survival and outcome if they would if they'd reach a trauma center within that hour. So they called it the golden hour, and that was the standard for a long time.
Because after that, the survivability rate really drops off.
Correct. I mean, depending on what that trauma is, we have necrosis of tissues and things like that. So that is always the standard, right?
Is it still?
I'd say it's not used nearly as much. I mean, it's like Jaws of Life, right? Everybody's heard of Jaws of Life. Well, they're really not called Jaws of Life. They're manufactured by many, many different companies, and they're called cutters and spreaders and things like that. So I think it's a universal term that is still in use, but not as much anymore.
And that would be because of advances?
Absolutely. Advances in scopes of practice, advances in equipment that we're carrying on ambulances, advances of having air ambulances available.
You can extend that golden hour.
We can, depending on what it is. Our goal is to ultimately get them to definitive care, whether that's the trauma center or the critical access hospital.
Well, you certainly don't want to dilly-dally, but
not at all.
That golden hour, I would think, is still a good standard to strive for.
Oh, yeah, absolutely. And it's difficult out here in rural Arizona. Now, this is very common, if we have a motor vehicle accident and that involves a trauma on I-10, let's say in the Mescal area, especially.
Right.
And take away the construction right now. The I-10 is
all right, it's
normal,
not
right?
happening.
So it's quicker for us to transport straight to the trauma center and not wait for a helicopter.
Is it really?
Absolutely. We can beat them every time, because you think we have to first make the request. They have to accept it. The pilot's got to do a flight plan. Yeah. He's got to get another pilot to agree that this is a safe flight. The weather's got to be good. Again, they got to get out there. They've got to, launch. So, and then, we know the short time is the actual in-flight air time.
Yeah.
But then it's get on the ground. How much time is spent there? They've got to come over to our crews, get a report, work in the back, figure out, transfer them to their board that's got to fit, because our stretchers don't fit in their helicopters.
Yeah.
And so, sometimes that's 10, 15, 20 minutes. So you add that to your ground transport time, because we've had it where they've left scene. We've launched and our trucks left scene and we've beaten them to the trauma center.
Wow. What else?
Not always that way, though.
What else should we cover as far as this rebranding goes?
Well, the big
thing
was...
You want people to know it's North County EMS, and that has to do with the fact that you serve such a large portion of the northern half of Cochise County.
Yeah, we want folks to know that, first of all, we're their service, right? we're part of this community and we're their service, and didn't want them to see this truck with a new logo on it and a new design and say, who's this guy now? I'm used to healthcare innovations or seeing HCI. What has changed?
The same thing.
Same thing as
but
far
better.
As, better. Well, as we move forward, definitely with this treat and refer CON that we're pursuing, it's going to give us a lot more options on how we take care of our patients.
Explain that.
So right now, with our certificate of necessity, we have two options when you call 911. We come to your house, Jeff, and you tell me, I really don't want to go to the ER. I want to, I just want to know if I'm okay. There's a law that went into place back in 2022. It's a refusal law that prohibits any provider from offering a diagnosis or coercing a patient to not go to an ER. So our only option is, do you want to go to the emergency room, or do you want to sign my paper that says you refuse all medical care against medical advice?
Mm-hmm.
That's a very difficult decision for folks, because a lot of times they may not need an ER, but they do need something, whether it's they're trying to get in with their primary care and they've told them, I can see you in 3 months, 4 months, or maybe they're having a behavioral emergency and they need to get to a behavioral health facility.
So this kind of forces the issue.
This allows us to say to them, and also create some partnerships in the community with, let's say, Chiricahua or Benson Primary Care Services or the clinic in Wilcox, to go to those folks and say, hey, we're doing this treat and refer program, and sometimes we may need to get somebody in. Would you block 15 minutes for us a week?
Oh, okay.
So instead of somebody waiting 3-4 months, tell them, I can get you in at Chiricahua on Tuesday between 11:30 and 11:45. Would that work for you? Or this person's having a behavioral health crisis, and now I don't have to go to an ER where they're going to have to do the same work as us to get them to a facility. We can go straight to a behavioral health facility and get them the treatment they need.
Because they've blocked out the time.
Well,
the 15
in that
minutes
emergency,
or whatever,
right?
Yeah.
Well, no, I'm talking about if on a 911, right? My only option with a behavioral health currently is I take them to Benson Hospital and they sit there for hours upon hours or sometimes days while they try to find a facility that's willing to take them.
Yeah.
So now you have somebody that's occupying a bed for a very long period of time that we could have went direct to a facility.
Oh, I
that
see.
needed
Okay.
them.
All right.
Yeah.
All right.
So, so that's what we're trying to do is how do we
Eliminate the backlog.
Yeah. And how do,
which is huge.
Yeah, absolutely. Because a lot of these folks, like I said, they need a little help. They don't need an ER always. Now, when they need an ER, that's the best place for them to go.
Yeah. Listen, can I tell you a little story? When I was working in West Palm Beach, and you were talking about a helicopter and air evac and all that. I want to tell you a story of a miracle that I covered. We got a call in the newsroom. It was probably, it was before the 10 o'clock news. I used to anchor for Fox News in West Palm Beach.
Very cool.
Yeah, it was a lot of fun. Great gig, great people, great, network. It was a Fox affiliate. But anyway, we got a call that there had been a air evac helicopter had gone down in the marsh area west of West Palm Beach, flying back from Lake Okeechobee. Well, he had gone down, but listen to this. They picked up a patient. There were 2 people on the helicopter. No, 3 on the helicopter. Picked up a patient at a small hospital near Lake Okeechobee, and they were flying back in bad weather. The pilot became disoriented, right? And this all came out after the investigation. He actually inverted the helicopter, flew inverted for who knows how long, and then, was trying to, I have no idea.
Down is up and up is down.
Yeah, down is up is down when you have no horizon. Realized something was seriously wrong. Somehow got his bearings, rolled the helicopter back. I didn't even know they could fly inverted.
I've seen the Red Bull helicopter do it.
Yeah, but apparently they can. Wow. And rolled it over. And just as he rolled it over, they broke through the cloud cover. They were 5 feet above the ground. And he dropped it.
Wow.
If he hadn't done that, they would have all been
divine intervention.
Right there. Man, something. Yeah, I couldn't believe it.
Wow.
That was all the NTSB,
yeah.
NTSB. It took about 3 months for them to come out with that. That guy, I'm sure he was kissing the ground.
Wow.
It's not an easy job.
No, I can imagine.
And for you
putting
guys,
in his retirement right after that.
So before we close out, share with me. I don't want it to be bad, but maybe the weirdest or the funniest or something that really sticks with you. You know, you showed up and some guy, was just totally off his run. What do you really remember? Give us a good story.
The big thing is if you do this long enough, you feel like you've seen it all, right? Yeah. And then here comes the one that you're just like, I can't believe this just
What's
happened,
the one?
Gosh,
this you're not going to break HIPAA.
Yeah. Obviously, you don't want to talk about any of that stuff, but I'll tell you.
I've got another one. I'll tell you.
Happened to me.
All right, go ahead.
A few years ago, and these are ones that kind of stick with you because this isn't about this is just about your safety. First to arrive on scene. Knock on the door, and you kind of get no response. You're a little worried, right? Door's kind of ajar. You push it open and you walk in, and someone's very upset you're there, and they standing there with a shotgun pointed at you.
Ooh, ouch!
Right, saying I don't want to go to a hospital. Well, absolutely, that's your
right.
Well, no problem. I'll see you later. You back out, and at that point, you advise law enforcement, and they'll come out and help that situation. Obviously, somebody that was in need of care, whether it was behavioral or medical whatsoever. But it's very difficult now. We're not law enforcement. We don't restrain people. We can chemically or forcibly if there's an order for it or if they're going to be a danger to themselves, right? So now we see that we're relying more and more these days on law enforcement to assist us with patients because someone falls and hits their head and they're altered. They're not making clear decisions for themselves, and they're telling you they're all right. And you're like, no, you really need to go to the hospital. You could have a brain bleed. You may die. But in Arizona, they have a right as long as they're coherent enough or what we call oriented enough to make that decision of whether they go to a hospital or not. And then a lot of times folks that are disoriented or altered they don't know it. And they think they're in their right mind and making that decision. They don't want to go. And we have to enlist law enforcement and things like that to help us, which is creating a burden on law enforcement as well. Mm-hmm. So,
all right, I'll share one more story. Absolutely true. I was a reporter. Let me think. This was my first year there. Anyway, there was a shooting, and it turned out to be a domestic dispute. We showed up after they had transported the couple to the hospital. Paramedics were kind of shaken up. Yeah. There were a couple still on the scene because 2 ambulances had been dispatched. I guess they thought there was more involved. But anyway, here's what happened. This couple got drunk. They were older. They got into an argument. He pulled out a .22 and shot his wife in the head, right? Or no, she shot him.
Oh, my gosh.
Let me get this straight. The bullet went in, circled around the skull, came out the back. He took a bandana, wrapped it around his head to stop the bleeding, and beat her within an inch of her life, and then he collapsed. Oh, and they both survived.
Wow. My father told me a very similar story. He retired from the Los Angeles Police Department, and he told me a story, same thing. Unfortunately, a gentleman trying to commit suicide using a .25 auto, put it up to his head, pulled the trigger, and it did. It traveled around the skull, between the skull and the skin, and kind of came back around. And eventually the hospital just took a scalpel and opened it up, took the projectile out, stitched him up.
He
right?
survived.
Yeah, he's really horrible at that. But a very similar story. So it must happen all over the place.
It happens. We can kind of giggle about it, but still, the circumstances are tragic.
They are.
But I couldn't believe this guy survived. Yeah. It's just amazing. Well, listen, Anthony, thanks so much for being here. Anything we haven't covered that you want to touch on?
No, that was it. Like I said, we wanted to educate the community, let them know we're still here. This isn't somebody new. This is the same service you've been relying on for 35 years, and we're still here to serve you.
Good. All right. Thank you so much for being here. We'll do an update whenever you think it's necessary, all right?
Absolutely. Love to be back.
All right.
Thanks, Jeff.
Yeah, ladies and gentlemen, we've been here with Anthony Kugler from North County EMS, doing HCI, doing business as North County EMS. Sorry, I'll get it right. Anyway, when you see the trucks with the new logo, remember, same ambulance service, same dedication to service, and the care of their patients. And we'll leave on that note. Catch you next time.